In this video, we examine the effects of molecular iodine against cancer. In the book, Cancer Self-Defense 101, Quick Tips to Help You to Survive, molecular iodine is listed in the Not Quite Ready for Prime Time section, meaning although it's promising, the human evidence doesn't quite rise to the level of the other supplements profile. As always, these ideas are discussed in more depth in the book, Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. The use of iodine against thyroid cancer and goiters is so well established that even thousands of years ago, people were placing kelp and sea sponges, which are high in iodine, on the throats of the afflicted. The use of iodine in cancer treatment nowadays is most closely associated with the use of radioactive iodine, a treatment for thyroid cancer. The thyroid preferentially consumes iodine, so the radioactive iodine is able to quite frequently destroy cancer in the thyroid and healthy thyroid tissue as well. Another tissue that preferentially consumes iodine is the breast. There is intriguing cell line and animal evidence that iodine can be helpful against numerous cancer types, but the only cancer type that has any human evidence is breast cancer. Before we delve into this information, we should briefly discuss the forms of iodine. There are numerous forms of iodine, just as there are numerous forms of magnesium, magnesium sulfate, magnesium citrate, magnesium threonate, etc. The form of iodine that has been found to be most promising against cancer is molecular iodine. This is also the form that is found least often in supplements. This graph shows the effects of potassium iodide, molecular iodine, and the combination of the two on different cancer cell lines. Potassium iodide is the lightest bar, molecular iodine is the middle bar, and the combination of the two is the darkest bar. The different names on the bottom represent different cancer cell lines. As you can see, potassium iodide, the form that is most common in supplements, has very little cytotoxic effect on the 5 different cancer cell lines. Molecular iodine has a dramatic effect, and the combination of the two has an even more pronounced effect.